If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. Now, this is our 14th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, you can email us your questions to askthedoctor@netny.net. And we're going to bring these questions into discussion. Now, for this episode, we have Dr. Helen Kilkin-Sogoloff, pulmonary medicine attending at New York Methodist Hospital. Dr. J. Herbert Balber, dental medicine physician. And we have Dr. Lawrence Stamm, kidney medicine attending at New York Methodist Hospital. Welcome. And we have a great show for you today, as you can see. We're going to get right to in the news, and we're going to get to meet our doctors. So what's going on? This was kind of a slow news week. I don't know. No, actually, this is the week they got...
slow news week in medicine.
In medicine. Mr. Obama, they got?
No, they got Bin Laden.
Bin Laden. Osama.
Obama got Bin Laden. So.
Anyway, it was good news, and I think... You know what was interesting? Before I get to in the news, tomorrow's May 4th, and if anybody's out there that was in school or college back in 1970 and May 4th, which was now 40 years ago, it was a time of unrest where students were shot and killed on the campuses, where kids were taking over buildings, throwing typewriters out the window, and if anything, the opposite of patriotic. You know, there wasn't a lot of feeling for singing the national anthem or God Bless America. And what a difference 40 years make. I was at graduation for my niece in Pittsburgh this weekend, and everybody was respectful. It was an entirely different type graduation than what I remember.
Different times.
Different times. And it's amazing how sometimes tragedies can unite the country at this point. You remember that 19th? Do you have? I know they let you take your grades as of May 4th if you wanted. So, kind of interesting. But anybody out there remember 40 years ago tomorrow? Amazing. Well, what's in the news? Well, mammo. When's the time to get a mammo? And remember last year the government put out a study saying you don't need to get mammos to age 50, and it caused a lot of tumult, and people were just very upset about it. Well, it seems like it did the trick because they plummeted the number of mammograms in women below the age of 50. And it's like 80% down, which we feel in radiology is a big problem because the more aggressive tumors are found in women 40 to 50. So we feel you should continue to get yearly mammograms starting at age 40. The official policy now is to let the woman decide with the doctor. But unfortunately now they plummeted, and as a result you get more people who may not survive cancer.
And that's especially if you have a family history of
Absolutely.
other women in your family who have had breast problems.
Absolutely.
Especially.
So women should be discussing this with their doctors and, you know, arriving at what's right for them, what's their level of comfort. Now, number two, another story, the hips. You know, we talked about this in the past. Not all fat is created equal. And if finding that people, let's say men, you have a 33-inch waist, you think, oh, I'm immune to heart disease, I don't have the fat in there. If you have fat in your belly, doesn't matter what your hips, what your waist size is. So that having a lot of this belly fat and the beer belly type thing is a problem, whereas fat around the hips is good fat and seem to be much better. So that the key is where is the fat located, and you want to have the hip fat as opposed to the belly fat. Now, stroke confusion. This is another story that I thought was interesting. They took kids 18 to 24 and they asked them about what they thought about their lifestyle now and how it might affect them when they're older. And they didn't see a connection. They felt that they could do whatever they want because they're young and they can worry about later strokes and heart attacks. And the studies are showing that you're laying the groundwork for future disease as a teenager. So it's very important that we educate this group to do that. And what do you think the average, they said, what age would we live to? The average was 98. That's what they felt, this group, 18 to 24. Next, it's busy week actually, babies and sleep. If you have an infant and you notice the infant starts sleeping longer hours, that's usually associated with growth spurts when they're going to be growing the most. So if your child is out there and you're lucky enough to have him sleeping, well, it's a good sign too. Number one, he's sleeping, so you're going to sleep, and number two, he's getting bigger, which is nice. Now, family meals. They found that the children who ate 3 to 4 family meals a week had much less incidence of eating disorders and unhealthful weight. So eating with the kids may be bad for your own nerves, but it's good for the kids, get together, talk what's going on in school, and it's something that's nice, you know, that having that family together also contributes to better health. That was a nice thing. And then also the allergy season, which I'm coughing on cue. We don't have many props here, so that's what I had to do. But it can be very severe for kids, and I don't know if Dr. Sokolov will comment on this later, that children who don't have their hay fever treated have an increased incidence of asthma later on. So you want to treat these children appropriately.
Absolutely. There is an absolute direct correlation between asthma exacerbation or exacerbation at the beginning of asthma in kids who have problems with allergies.
So we're going to talk a little bit about that. Of course, Monsignor Bennett, beautiful weather today, Monsignor. Yeah, Monsignor was commenting he couldn't believe 40 years have gone by since May 4th, 1970 either. But anyway, it's good to see you. And a shout out to a volunteer at New York Methodist Hospital who loves Little Italy, Phyllis Siracusa, who's there every day.
Yes.
You're aware?
Oh, yes.
Giving out the newspapers, well, she charges, right, for them?
Candies, newspapers.
I don't know. She got me for 75 cents for the post. I don't know.
Yeah. She's one of my favorite people at Methodist.
Very nice woman. So we want to say hello to her and her husband. And now we get to the quiz. So get your pencil and paper out there, and here we go. Which member of the Bush Senior now, with Bush Senior, George Bush, what was that number? Do you know? 42, 41? The older Bush. Which member is said to have earned 4 times more than the president did in 1999? So which member of the Bush Senior administration is said to have earned 4 times more than even the president did in 1999? And while it's kind of a tricky question, we'll give you some hints later on. So we're going to take a short break, and when we come back, we're going to be going right to your questions. So the topics are lung disease, dental medicine, and kidney disease. The number to call is 718-499-6101. You can also email your questions to askthedoctor@netny.net. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are lung disease, dental medicine, and kidney disease. Now, let's meet the doctors. Got Dr. Sokolov, a very popular guest on the show.
Thank you.
Tell us what's new. How about this? Is this a bad hay fever season?
It is a terrible hay season because it's enough just to get outside and look at your car, and it's usually covered with a very thick layer of pollen, and that's why I think we're all very busy.
And that's the stuff that does it to you, that green stuff?
It's not necessarily, that's part of that, all the pollen in the air, and that's why the counts I announce every single day, and that's why the offices are very busy.
It's a bad, what is it, because of the snow we had in the winter, you think?
I don't think so. I don't think it has any relation to snow. It's just all of a sudden every single flower is blooming. I'm convinced there's just more flowers planted every single year.
But it can be treated, right, and should be treated.
Must be treated. It's not even a...
Very good. So out there, you have kids, you know, you're suffering. You want to get out there because I think it causes depression, sleeplessness, right?
Absolutely, and being very tired and clearly not producing very well during the day. So it's
any exciting vacations? I know you always go on nice trips.
I can't wait to go on one
Where are you going?
this summer. Actually, I'm going to be going with my son to California. So.
Oh, nice, nice.
Yeah, beautiful. So it's going to be wonderful.
Very nice. Great to have you back.
Thank you.
Dr. Balber, you had an exciting last few months. I know you were on another station.
Yes, I was on another station.
Yeah. We won't mention the station, but tell us a little bit about it.
Well, it was I was on the People's Court, and it was a very interesting thing, very interesting to go there and to be on court. It was all legal, and it was done very properly, and
You won the case.
Oh, of course, but that's...
This was an alleged...
This was an alleged, she didn't she didn't have anything right, basically. That was, you know, everything she said was not the truth.
But justice prevailed.
Justice prevailed because the judge understood everything.
Just between me and you, how much do you get for something like that?
They give you a fee for appearing.
But if you were to win, do you get more money?
If you win, you get the money. They pay you. The
station
Court pay you.
But if you lose, so the person.
If you lose, you don't pay either. They pay.
Interesting.
It is interesting. It is, but it's all legal, and it's basically a good judge and a very nice setup.
And we hope to get dental questions out there because we know everybody's got dental problems these days. We're going to talk about implants and TMJ, right? What's the biggest, most common thing you see?
Well, most common thing in dentistry, what they're talking about today mostly is implants.
Implants.
And they've made great strides with implants, and the success rate is amazingly high. And when I went to school, the saying was, there's nothing as good as your own tooth. But now there's something that's even better, because it doesn't decay,
wow.
It doesn't break down, and it'll last
I wonder
forever.
if they'll be taking everyone's teeth out of birth and putting these in?
Why not?
Take them out. But thank you very much for being here. Well, a lot of questions for Dr. Balber out here. Dr. Stam was, again, we have 3 very popular guests here.
Always a pleasure to be here.
Thanks a lot. It's great to see. How's the book sale going?
Book sale's going well. We have sold over 50,000 copies of 100 Questions and Answers About Kidney Dialysis, which was a book that we...
Where can I get this if someone wants
You can get it from online at Amazon, Barnes & Noble's are the best way to order it. It's not really in your corner bookstore, but it's something that you can...
It's a great book. It's so simply written. You'll enjoy reading it. You know, even if you don't, everyone's touched by somebody with kidney disease, and I think it's a good idea.
Well, it's a good point. We're having an epidemic of kidney disease in the United States and the Western world, really based upon the increasing incidence of obesity and type 2 diabetes. So this is something which is really going to be touching all of us in the years to come as physicians.
And you brought 2 friends with you, so hold it up.
We have 2 kidneys, about the size of our fist, and we have an artery which provides blood, and the kidney's main function is to,
What's that white thing on top?
Filter. This is an adrenal gland. It's a small gland that sits on top of the kidneys, which is included in our model today.
That gets you excited, right?
Yeah, it produces important hormones, keeps your blood pressure in the right range. It lets you respond to a whole host of different stresses.
And that tube coming out of the kidney?
This is the major collecting system, the ureter of the kidney. The kidney is basically a filter. Blood is filtered, and poisons, salts, acids are collected and go from the ureter into the bladder so we can eliminate them from our bodies. Yes, that's right.
Very nice. So as you answer the questions, you'll be able to explain how it's related to high blood pressure, how it's related to kidney failure, and stones.
We're hoping for some really great questions tonight about the
Very
kidneys.
good. And anybody watching at home?
Yes. My lovely wife, Claudia, and hopefully my 2 children, Charles and Elizabeth.
Excellent, excellent. So great to have you. On the quiz, by the way, one of the camera guys pointed out the question wasn't really fair the way it was worded, so I'm just going to change it slightly. It's what a resident of the White House as opposed to a member of the administration. So what resident of the White House made 4 times more than the president did in George Bush Sr.? Is that good? Okay, got the okay on that one. So now we're going to go right to our first question, and we're going to go to Jane on line 1. Hi, Jane.
Hi, how are you?
Hi, where are you calling us from?
Middle Village.
Middle Village. How are you tonight?
Oh, not so good. I wanted to ask you a question.
Sure,
I'm
what's
a
up?
diabetic, so I had 2 treatments of chemo already because I have breast cancer.
Oh, you called before?
Right.
Yes.
And the problem is my sugars now are out of control.
Okay.
It takes a good 5-6 days for them to come back to normal.
All right, let's ask Dr. Stam on this. Actually, she's got breast cancer, having chemo now. It's going to have radiation to follow, and she's having poor control of her diabetes. Is common?
Well, certainly when you're undergoing chemotherapy and radiation, your whole life is different. Your food intake will change. Your response to medicines may change, and I think the most important thing is to be very, very carefully monitored. When we have breast cancer, our first thoughts are getting cured and getting well, but we can't forget about other aspects of our health, and you really have to keep up with your internist or your diabetologist, make sure that your medications are changed, that they're adjusted so that you get really good control. We know for all kinds of other diseases that good diabetic control is a recipe for successful treatment, whether it's heart disease, cancer, infection, a whole host of things are really go a lot better if our blood sugars are
Well,
well
before
controlled.
the chemo, it was my A1C was 5.5.
Which is excellent. That was
Right.
an excellent.
But after the first chemo treatment, my sugar shot up to 477.
And they give you prednisone. They give you medications that can
Perhaps,
make
perhaps that's a reaction to one of the medicines you're on. I would discuss that with the.
They gave me, well, they said if it goes over 200, take glyceride. And that didn't work. It takes like 5-6 days for it to come back down to normal. And then I have this ravenous appetite for sweets and food.
You know what? It's not gonna. It's only gonna be a few weeks more, the chemotherapy.
No, not until September.
Right. I mean, even through September, I think as long as you keep it basically under control, it's going to get better after the treatment. So you want to try and keep it within reason, but I wouldn't go crazy. You got so many things going on right now that you want to get through this chemo, and you want to. So try and keep it as good as as good as you can, but don't go crazy with it.
Well, the eating, I can't control the appetite.
That's a side effect, that people have.
Really?
Yeah. And that nodule in the lung was negative, right?
Yes.
Which is good. She had a nodule
Excellent.
in the lung. So you keep plugging away, and keep it under reasonable control.
And my food has no taste.
Yeah. Again, it's going to go away after the chemo stops.
Really? And the constipation?
It's all going to get better.
I hope so.
All right, Jane?
Just plug it in,
Keep
say
plugging
one in
away.
there for me. Okay, thanks a lot.
Take care. Hey, Joseph. Joseph,
Yeah,
how you doing?
fine.
Where you calling us from?
Woodside.
Woodside. How you doing out there tonight? You sound a little quiet.
Yeah, it's a little quiet.
Yeah. What'd you think about that catching this guy?
What's that?
Are you happy? Where were you when you heard that this guy was caught, Osama?
Oh, in fact, I went to bed because I heard that the president was coming on, but he came on later than I expected. And my wife then told me in the morning what, that he was...
It's amazing. I mean, it may not put an end. It's actually obviously not the end of the problem, but it feels good.
Right.
So what can we do for you?
Well, I'll tell you, it's about 2 years ago, I had an MRI taken, and it showed a cyst on the pancreas.
Okay.
Now, should I be concerned about that? It was only the size of the head of a pin.
Okay. Who is it? Dr. Sogolov?
Well, actually, you have to look at the history of whether or not you had the problems with the pancreas before, whether or not you have the history of pancreatitis or history of gallstones or gallbladder disease. And usually the cyst of that size is insignificant, but the caution, at least giving the parallels with the lung, is that you should follow it carefully and
Right.
initially
Did you get any repercussions from it?
No, if I were you, what I would do is that I would follow it with MRI every 6 months the first year, and then usually every 9 months for the next year, and then usually if that's stable, then it's considered to be a scar tissue on the pancreas.
Oh, I
But
see.
it has to be followed carefully.
How old are you, Joseph?
I'm 85.
85.
Oh,
Beautiful,
okay.
beautiful.
Beautiful, yes. Then,
God bless
yes,
him.
God
And
bless.
I read your article in the tablet every Sunday.
Oh, thanks a lot. Thank you
Yeah.
very much.
My
And,
wife is a great fan of yours.
how's she doing?
She just came back from Ireland.
From Ireland. Very nice. It's a beautiful
Yeah.
place, huh? Anybody
She's
been
from
in?
Ireland. We were married in '68,
Wow.
and I went over to Ireland and got married.
How many years is that now?
In 1968,
43.
43, yeah.
43 years.
right,
So 53. 53 years.
right,
Very good.
right.
Many, many more.
Okay, doctor.
Take care, Joseph. Ivan. Hi, Ivan. Ivan,
Hi, Dr. Gardner. How are you?
how you doing? Where you calling us from?
Midwood.
Widgewood?
Yeah, you remember me.
Yes, yes, yes.
Midwood.
Who you? Refresh my memory.
Midwood.
Midwood High School?
No, Midwood and Brook Avenue J.
Oh. Oh, yes, yes, I met you on Avenue J.
Right.
Yes, I was walking along, I was accosted. I don't know what happened. No. So what's the good word?
I think I have the answer.
Oh, really? Who is it?
Jeb Bush.
Wait a second now. We have a sound effect, so I'm going to ask. Okay, the sound effect's ready? Okay, Ivan, give us the answer.
Jeb Bush.
Jeb Bush. Is it Jeb Bush? Oh. Ivan.
Yes.
It didn't work out.
Didn't work out.
I'm really sorry.
I have a question.
What's the question?
Okay, it's a very strange thing, but nobody could come to a conclusion. This is for the dentist, for the dental.
Okay.
Okay. What happened is every morning when I get up and I go in to like brush my teeth with the regular toothpaste, you know, the Crest, the Colgate, whatever, I come out and my face is fire engine red. I'm getting a very bad flushing from the skin, usually from the neck to the forehead, and it could last anywhere from 4 or 5 hours after I brush. But I notice it's always happening after I brush my teeth. Is it possible, or is it some ingredient in these toothpastes that could cause that I should try to avoid?
So just brushing his toothpaste.
I would say, just offhand, that it's some kind of allergic reaction, something in the toothpaste or on the brush that's causing that, because that's a very unusual thing to happen.
Is there something that may be less hypoallergenic?
Okay, just the only.
I just want to ask Dr. Balba, is there a toothpaste that might have less sensitivity to it?
Toothpaste are generally specific for like caries prevention and fluoride, etc. But I'm not aware of anything that's hypoallergenic.
So what are we going to do with Ivan?
Okay.
I think he's got to go to an allergist and check it out. Bring his toothpaste.
One other question, Dr. Gardner.
Yeah, Ivan.
To make it fast, I was in the hospital, Methodist Hospital on Friday overnight. I came home from walking all day in the city, and I looked at my ankles, and they all swelled up and very red and swollen with water. And I went to the emergency room, and they said that I have water retention, that it could be from the Norvasc that I'm taking. And they spoke to my doctor, and the doctor said, get off the Norvasc, and they put me on Cozar. And I took Cozar, and I Cozar and the Norvasc, I've been getting flushing in the skin. She thinks that's what is causing it. It's the Norvasc. So she put me on Cozar, and I got red again because there's something in these medicines that are making me very flushed. And she started me today on, I don't know if you know Metropol.
Yes.
Metropola.
Yes.
And do you think that could be less red on my face, or we don't know?
Yeah, I'm going to ask Dr. Stam to address that one.
Well, your doctor's absolutely right. The Norvasc can cause, the amlodipine can cause swelling of the legs. It's a class of drug which is known for this side effect. And it seems like your doctor is changing you to another very, very appropriate medicine. Unfortunately, you don't seem to be getting along with that one, and now you're on the metoprolol, which is a very safe, a very effective medicine for blood pressure. It's cardioprotective, it's good for the heart, and I'd encourage you to continue to take it and see how you do on it.
Do you think the flushness was from the medicines more than the toothpaste, does it sound?
Very, very often with allergies, there are multiple factors. In fact, some people with allergies, we never ever can find out what the exact reason is, whether it's laundry detergent, medication, whether it's allergy to toothbrush. The best thing to do is to try to bring all the factors. Certainly you need to take your medicines for your blood pressure. That would be the most important thing. And I think there are certain alternatives to brushing your teeth. Some people can use other things that are...
It's interesting. I like Dr. Balba's, to see him, maybe see an allergist. Sounds like he's getting sensitivity to many different...
That would be my advice.
So, Ivan, I hope that helps, and I hope to see you on Avenue J soon.
Yes, thank you.
Take care. Be
Take
well.
care. Bye-bye.
Go to Dino now. Hi, Dino.
Hi,
Dino, where you calling us from?
I'm calling you from Bay Ridge.
Bay Ridge. So where do you like to go out to Bay Ridge when you go out?
Dr. Garner, I have the greatest restaurant in the world.
Well, now you put a smile on my face. Where is
I got
this?
a quick little thing I'm going to tell you. I used to drive a limousine, and I had to pick up Steve Landesberg, you know, from the Barney Miller
Yeah,
show?
yeah, funny guy.
Okay,
Steve
I
Landesberg.
picked him up, and when I saw him, I go, oh, my God. And I said, where are you going? He said, I'm going to the Bronx. So I said to him, Steve, you're going to the Bronx. You come all the way out to Brooklyn to eat? He said, listen, my wife and I have been all over the world, and my wife believes that this is the greatest restaurant she's ever eaten in. And the restaurant is Ponte Vecchio.
Ah, Ponte Vecchio.
Great. One of our favorite.
So so the funny thing is, I got so friendly with him that every time he called, he came into Brooklyn. He called me up. He took me to a Yankee game one time, and everything. So anyway, that's a quick story. Now, as far as can I get a minute to tell you my problem?
No, you got a good delivery. I like that. Yeah, it's very good.
But this is all right. I got a situation that right now that I'm having. The last couple of months, I've been having headaches. I've been hard breathing. I have extreme fatigue, especially in my legs. And the funny thing is, today I was watching that Dr. Max on Channel 2, and these, he said, are all the symptoms of sinusitis.
I'll tell you something about Dr. Max. He's not a doctor.
Oh, he isn't?
PhD.
Oh, okay.
But anyway.
All right, so anyway, so I just, and the funny also thing, I have Dr. Bakash. I got him as a doctor. I saw him on your show. So he's my primary care doctor now.
Excellent, excellent.
Okay, so I'm going to see. So do you have any, should I should I see a sinus specialist?
See, I pick up you're getting very tired, fatigue.
Yeah, my legs very weak.
How old are you?
I'm 79.
79. You feeling depressed at all?
No.
Very good. So anything anybody in the panel want to comment?
Well, certainly leg weakness would not be my first thought as connected with sinusitis. You can be weak from sinusitis, you can be debilitated, it's the right season, but it seems like your first step would be to go to Dr. Bakash and have a complete physical exam, have him run some blood tests on you and see if he can determine from talking to you and examining you what direction to go in. Very, very often we tend to want to go to a specialist. We want to go to a cardiologist, we want to go to a neurologist, but very, very often if you have a relationship with a doctor, you're comfortable with that doctor, he knows you, he's the best one to sort of guide you in terms of what direction that this group of symptoms might be coming from.
I think that's a great answer because they're going to do blood work, they're going to do a physical exam, listen to you a little bit, Doctor.
Absolutely, do the EKG and to make sure it's not something which is related to lungs or heart directly, so absolutely, that would be a good way to start.
I'm going to see my cardiologist tomorrow.
That's a good bet. And also I want to ask Dr. Balber, you see things in teeth that may be related to a systemic or to a body-wide process. Does this,
Well, there could be a lot of things. You could have an infection of some sort, but I think that Dr. Stam's advice is the best.
I know diabetes, right, may have some...
I am a diabetic.
Right, so some, this may be tying into some of the problems. They'll look at your control and so on. But it sounds like it's something hopefully can be managed. And is that Ponte Vecchio had been redone recently?
No, not that I know. Doctor, I don't go there that often because it's very expensive. But I went there on my birthday in November. I wanted to treat myself.
Very nice.
Yeah, so... But anyway, that's the
Thanks for the Steve Landesberg story. We like that.
Oh, okay, great. Great talking to you, Doc.
Good talking to you. Be well.
All right, thank you.
Now, before we get to the next question, I just want to mention that the Net, which is our station, just like any other nonprofit organization out there, is feeling the pinch of these tough economic times. Now, this isn't a pledge drive, it's just me talking to you. If you enjoy programs such as Ask the Doctor, then please show your support. Whatever you contribute is much appreciated, because the main thing is we know you care and that you support us. Also, if there any business out there would like to be an official sponsor of Ask the Doctor or take commercials or any part of the show, we'd like to partner with you. So please contact us on the number on your screen. Now we're going to get back to your questions. We're going to go to Anthony on line 1. Hi, Anthony.
Hey, Doc. How are you? Good
How you
evening.
doing? Where are you calling us from?
Middle Village, New York.
Middle Village. What's out in Middle Village?
London Lenny's.
Oh, you can't beat that.
Can't
right?
beat that.
You ever
Absolutely
go to
not.
London? That is a great
Yes.
place. Fresh fish, right on Woodhaven Boulevard out there.
Absolutely.
Prices are great.
Prices are expensive.
Very, yeah.
But it's okay.
Anyway, but cheaper than Ponte Vecchio. Have you ever been there?
No, I have not been there.
Where's that place, Ponte Vecchio?
It's out in Bay Ridge.
Yeah, somewhere on 4th Avenue.
4th Avenue.
Yeah.
I believe, yeah.
Have to get out there again. What can we do for you, Anthony?
Actually, I got a question. I have a 51-year-old uncle who lives in Catskill, New York, who is currently on dialysis 4 times a week, and he's also a bad diabetic. But the problem I just visited him this past weekend. He gets constant swelling all around his eyes and his cheeks, and he's having a hard time walking.
Okay, so who wants to jump in and take that one?
I'll give a shot at that one. Certainly the fact that your uncle is on dialysis 4 days a week is an extra day. Most of the people are on 3 days a week, and it seems like his physicians are struggling with this fluid overload. And the way that they're addressing it is by increasing the amount of dialysis. Now, certainly swelling of the eyes, swelling of the face would indicate that he has too much salt and too much water in his body. What I would want to do with him is I'd want to sit him down and try to find out what is he eating and drinking, and whether there is some dietary recommendations that could be made to really sort him less swollen and get him back on the right track. It sounds like he's got a severe overload problem, and it seems like he's struggling with it and not doing as well as he can. At 51 years old, I think that he would be a good candidate to start talking about the possibility of a kidney transplant. Maybe he could get off dialysis, and certainly a new kidney would work 7 days a week and try to get some of this excess fluid off of him. He might feel better with a kidney transplant.
All right.
What are some of the reasons that a 51-year-old is on dialysis? Kind of young. What is that?
Well, it's actually not very young. We have many people of that age, and that would be sort of a typical age to really begin end-stage renal failure therapy. The #1 cause in the United States is diabetes, and that really would be the #1 reason for somebody needing dialysis.
Wow. Oh. I have one more quick question, Doc.
Sure.
Recently, we just had a friend of the family passed away. She was 40 years old. She died from stomach cancer. And at the end, they said they could not stop the blood clotting. I never heard of stomach cancer. If you could just enlighten me a little bit, what causes it? She was only 40 years old.
Yeah, you wanted to, talk about in general cancers and what they do to blood. Yeah.
Well, actually, stomach cancers and predisposition to ulcer diseases and H. pylori, there's a lot of things in the literature about this. But unfortunately, the cancers, it doesn't really matter, lung or heart or colon, some types do predispose people to a lot of clotting in the legs, and eventually it ends up being in the lung and every single vessel, which is a serious problem. And you have to treat the cancer to get rid of it. It's not that you have to treat the clotting disorder. It's a clotting disorder that's caused by cancer particular. But returning back to the stomach cancer, if someone has pain in their stomach and it's not going away with the regular medications over the counter, I know 40-year-old is very young, but I certainly would be insisting that someone would have endoscopy just to make sure that it's not related to H. pylori, because in the community where I practice, H. pylori is a serious problem, and I will never...
Sad story, Anthony.
Yeah, it's a very... And I'll try for the trivia if you don't mind real quick.
Okay, so let me just rephrase the question. It's what resident of the White House during the senior Bush administration made 4 times as much as the president did? Now we're ready. We got the sound effects revved up. What's your answer?
I'm going to say Dick Cheney.
Is it Dick Cheney?
All right,
and he's not really a resident of the White House. Somebody who's living in the White House, right? I don't know. There's more sound effects going on out there. They're having their own show.
I like the sound effects.
Yeah. But anyway, Anthony, it's great to talk to you, and call us back. Take care.
Thank you.
I think we've earned a break at this point. We've got a lot of calls. So what we're going to do is we're going to take a short break, and when we come back, we're going to be discussing lung disease, dental medicine, and kidney disease, where we have Dr. Helen Kilkin-Sogoloff, Dr. J. Herbert Balber, and Dr. Lawrence Stam. Do you have a middle name?
Lawrence
Eric Stam. So we each have a middle name. I'm Dr. Stephen Charles Garner, and we'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on net.
And welcome back to Ask the Doctor, where our topics are lung disease, dental medicine, and kidney disease. Now let's go right to the questions. And actually we have an email question from Dr. Mahboob. This is from Mahboob in Sibi. I cannot pronounce this. If anybody's good in Pakistani, it's Sibi Balochistan, Pakistan. I can't believe someone's watching us on the internet there. I don't know what this is. Respected sir, from a long period of time I'm feeling hypotension. Sometimes my blood pressure goes 90 by 70, and sometimes it's 120 by 90. When it's 120 by 90, my heart goes so fast, like 85 to 90 beats per minute, I feel I'm afraid. I do not understand what is going on with me. I have tension in my person, but in my personal opinion, he's not overly tense. And he gives us his height and weight, which looks normal. And he's wondering now what's going on. And he wants this blood pressure, hypotension, too low, he feels it is.
Well, certainly the blood pressures that you described, sir, are within the range of normal. And it's very, very often people have a sense of dizziness, a sense of anxiety, a sense of sort of concern, which could be due from something else, some other medical condition or some other condition. So the fact that your blood pressure is that level is normal, your heart rate is normal. I would ask your doctor what else could be causing these feelings. It doesn't seem like it would be the blood pressure, in my opinion.
But we thank you for the call. That may be the longest call from distance that we ever got from Pakistan.
He's pretty thin also.
Yeah.
It might have something to do with it.
Was he taking any medications? We didn't get we don't know if he's taking medications which may be causing hypotension. We have another emailer from Johnny in Whitestone, and we're going to get back to our busy lines right after this. He's 63 years old. He's waking at night with night cramps. Is there any remedy for this? And he throws in another one now. Also, my mother, Rosemary, she's 85, feels all her muscles are deteriorating. She's drinking Ensure for muscle health. Will this help restore the muscles? So let's get to the night cramps first.
I would definitely check the vascular, whether that's a vascular problem, and I would definitely do the blood work to make sure it's not electrolyte deficiency or excess. That would be my approach before deciding what to do and how to treat it. And as far as Mother Rosemary, quite honestly, I don't think that Ensure is actually increasing the muscle health, but if she's not having enough intake, otherwise it would be a helpful thing to do if she's losing weight.
So thanks a lot for that. We hope that helps answer your question. We're now going to go back to our live lines. And Kate, hi Kate.
Yes.
How are you today?
I'm all right.
You don't sound good. You sound like you're a little bit under the weather.
No, I'm fine.
So where are you calling us from?
I'm calling from Bayside, Queens.
Bayside is nice. So just give us a quick place out there you like to go.
Pardon me?
Which restaurant in Bayside do you like?
Oh, there's lots of restaurants in Bayside, Queens.
Yeah, which one do you like the best?
Donovan's, Monaghan Fitzgerald's, Jimmy's.
Jimmy's. How about Jimmy's?
Jimmy's, it's an Italian restaurant.
Yeah, it sounds excellent. Where's that near?
It's on Bell Boulevard.
We have to try Jimmy's. Anybody hear of Jimmy's? Yeah. Thanks a lot for that tip. What can we do for you?
My daughter had a kidney transplant on February the 10th.
Okay.
And she's very stressed out from it, very down, you know. She seems to have no energy at all. And the medication that she's taken, it seems to upset her stomach.
Okay. How old is she?
She's 48.
48-year-old, had a kidney transplant a few months ago, is feeling...
Well, certainly when you have a kidney transplant, your whole body feels different. You're under new medicines, and you would expect everybody to be incredibly grateful and happy, but in fact, having a kidney transplant is a very, very stressful experience, and most of our patients take a little longer time to settle in. We really find that it takes up to a year or even 2 years till their life gets totally back to normal, both psychologically and physically. Very, very often patients are on higher levels of medicine initially, right after the transplant, to prevent rejection. And as time goes on, the levels of medicine are decreased, patients' appetites pick up, they become stronger, and they get back into a more normal kind of existence. Certainly it's a wonderful thing that she was able to get the transplant, but it's going to take a little more time than we would like for her to get back to a more normal lifestyle.
So this is not unusual?
This is not unusual.
Good.
She should keep going. You should encourage her. The most important thing is she needs encouragement that she's doing a good job, that she's being brave, to keep up her appointments with the transplant team, and to bring some of these symptoms to their attention.
Did she get the transplant through a list?
Tommy?
How did she end up, was she on a list for the transplant, that is someone's
no,
family?
her sister gave her a kidney.
Very
and
nice.
then she got the kidney when they heard that her sister was given the kidney. She got it right away, but she didn't get her sister's kidney. Her kidney came from California.
It's sort of a swap. Very, very often when we have relatives who want to donate to us who are incompatible, we go on the internet, we have ways of giving a kidney to somebody else whose donor gives to
Right, so it's like a
to
three-player
ours. It's called a
trade.
swap,
Yeah, yeah.
and it's really an exciting thing that we've been able to do recently.
Yes.
Good luck to her. I'm very, very optimistic.
Congratulations.
Thank you very much, Doctor, and I really love your program, and I love the tablet.
Thanks.
Writing in the tablet every week, I keep up with it.
Thanks a lot. Keep calling.
Okay. God bless you all.
Bye. Sheena.
Yes.
Hi, Sheena. It's a nice name.
Thank you.
Is that the way you pronounce it, Sheena?
Yes.
What is it? Oh, I see you've got some company. You have some company with you tonight.
Yes.
Who is that?
I would like to speak to Dr. Barber.
Yeah, he's right here, Dr. Balbo. Who's that little baby in there?
That's my nephew,
Very nice. What's his name?
Ethan.
Ethan. Nice name. So what
Thank
can we
you.
do? What's the question?
I would like to ask Dr. Barber, how long does implants take to heal, and does it hurt?
How long does implants take to heal?
It's a very legitimate question. From the time of placement, it can be several months. Depends on how quickly you heal, and with your checkup x-rays should tell when the implant has integrated with the bone. But usually about 3 months, 4 months, something like that.
So does that mean you can't chew on it for 4 months?
Well, there are instances where you can, what they call load it. In other words, you could actually put a tooth on, but it has to be supported in the right way. Usually, though, most of the time you leave it in there and let it integrate with the bone, because any kind of pressure on it will stop the integration and will cause it to loosen up.
Just out of curiosity, what is an implant would it cost somebody out there?
Well, it depends where you go. Implants vary from thousands to
just to get an idea. So it's in $1,000 ballpark.
At my office, it's the implant and the tooth replacement is less than $2,000, which is very reasonable. But
we'll
you
have
can
to get
easily
there by Thursday, or it's okay.
Dr. Barber, do you place the implants yourself?
Pardon?
Do you place the implants
Yes.
yourself?
Yes, we place the implants ourselves in the office.
So it's good to know, because I guess there is a great variety. You want to go to someone who's doing a lot of them,
Yes,
right?
we've done a lot of them, that's for sure.
So,
And we haven't had a failure,
excellent.
which is more important. It's a very high rate of success throughout. It's way over 95%.
Sounds good. Thanks for the question.
Thank you.
Take care, Sheena. We're going down to Jack. Hi, Jack. Jack.
Hi.
How you doing? What's up tonight?
All right. How you doing?
Okay. How are you doing? How's your voice? It sounds a little hoarse.
I wanted to ask about
What do you want to ask about?
the lungs and kidneys.
The lung and the kidney. You hit the jackpot here. Any teeth problems?
No, I'm diabetic.
Okay.
And I want to see how I can protect my lungs from getting damaged.
Where are you calling us from?
From Bensonhurst.
Bensonhurst. That's a nice neighborhood out there, huh?
Yeah.
That wasn't too fun. No, what can we do for you?
Well, I wanted to find out that about my kidneys.
Okay, let's start with the kidneys and diabetes.
1986.
I'm sorry, in diabetes since 86?
Right.
Okay, that's about 30 years almost.
Yeah.
Well, the most important thing that we've learned in treating diabetics is the better your glycemic control, the better the blood sugar is, the better off you are from a kidney point of view. Blood pressure must be controlled. High cholesterol needs to be really addressed. And the worst thing you can do as a diabetic is smoke. You're asking a little bit about lung protection also in there, and I think without a doubt, we see so many of our diabetics still can't give up smoking, and if that's the case, that's a red flag in terms of your kidney health. Believe it or not, your kidney disease gets worse because of hardening the arteries to the kidneys.
Dr. Sogolov, what about in general lung disease and diabetes?
Well, the lung disease.
Wait, Jack, wait, I got Dr. Sogolov. She's answering
sorry?
you. Yeah.
No, actually,
I stopped smoking about 28 and a half years ago, almost 29 years ago.
Great.
That's wonderful.
Okay.
Now listen to this part 2.
Part 2. Well, in general, diabetes is not really associated with lung disease. Thank God for little favors, but smoking certainly is a huge problem. And these days, there is truly no excuse. You must stop smoking because there's a lot of publicity, and it's not only affecting the lungs, it's affecting your heart, it affects kidney,
and other
it affects
people.
everything.
And other people.
And other people. And these days, there's so many medications that help you stop smoking. And Chantix, which was introduced a few years back.
I just stopped smoking all on my own, and I lost 20 pounds. Most
oh my God, that is
when
wonderful.
They stop smoking, they gain weight.
Well, actually, your doctor's dream come true, I think once.
Yes.
Jack, thanks a lot. We appreciate the call.
And, well, the other thing I wanted to say, can I just say one more
Yes,
thing?
sure.
I just wanted to say that I know that you doctors are from Methodist Hospital, and I wanted to give a call out to my doctor, Dr. Henry Tishler, who successfully put in a great hip into me. And the man is fantastic.
Yeah, we know Henry very well. Excellent doctor, excellent orthopedist.
Yes, he's fantastic.
And where do you go out there to eat when you go out? Which one?
Well, there's a place called the Bridge Diner on 91st.
Very nice place, the Bridge
and
Diner.
3rd Avenue in Bay Ridge.
Very good, very good. So
Yeah.
I think they cleaned that place up finally. Okay, Lisa. Hi, Lisa. How are you?
Okay.
Where are you calling us from?
I'm calling from Midwood, Brooklyn, New York.
Oh, very nice. We had another call from around Avenue J, or where are you from?
I'm Avenue P.
P. Beautiful neighborhood out there.
I know, really nice. I love it.
Ocean Parkway is beautiful out there, isn't it?
I know, really nice.
What can we do for you?
Okay, I have a question. I'm 73 years old, and I'm using Metopol for my high blood pressure, and I'm using it for about 10 years now. So I want to know, could this in any way harm my kidney or my liver for taking it that long?
Okay, Metopol, does it
Very, very often we're very...
Metopol 50 milligrams.
50 milligrams. Very often we're very concerned about the effects of long-term medicine, but without a doubt, metoprolol has been on the market for many, many years. It's one of the safest drugs that we use for the heart and for high blood pressure. It's a generic drug, it's safe,
Correct.
and really, if you're on a drug, you're going to be getting blood tests every year or so, and your doctor will check to see if your liver is affected, but it definitely will not affect your kidneys. It will help your kidneys by controlling your blood pressure. It'll keep your kidneys healthy. It's a very, very good drug for the heart. It's you're in good hands.
Thank
Sounds
you.
like it's working.
Thanks a lot, Lisa.
Thank you so much. Listen, I love your show. I love you. God bless you all.
Thank you very much. Watch next will be watch a rerun at 10 o'clock tonight if you want, okay?
Okay, sweetheart. Thank
Take
you
care.
so
Bye.
much.
I want to ask, we're going to go to Larry. Just Dr. Balba, quick question. I come in, how do you decide if I need a root canal or an implant?
Well, we do an oral examination, take x-rays, and determine what the best course of treatment is. Sometimes a root canal is best, and sometimes the implant is the best. Depends where the tooth is located, the periodontal condition of the tooth, and various other factors.
Okay, now we get to our rapid fire part of the show where we try and get through all our calls. We're going to go to Larry. Hi, Larry.
How are you, Dr. Garner? How's everything?
Is this the Larry from Rockland County?
That's correct.
You got B. We had a Pakistan caller tonight from Pakistan.
Well, I'm not as far as Pakistan.
I didn't ask which neighborhood, but anyway, what can we do for you?
I have a question for Dr. Balber, if I may, a two-part question. Doctor, my wife had a procedure done the other day, and a surgical procedure, and the person told her that she has bone resorption, and my question is, what is it, and how do you correct it?
Well, bone resorption means that there is a loss of bone from either the alveolar crest or around the tooth. I don't know what kind of procedure, what kind of surgical procedure.
He cut on both sides of a tooth, a gum, because he was looking for a cracked root on a tooth that had root canal.
I see. So what he did was he made an incision and went in to the root of the tooth to find out if there was a crack in the root itself.
Right.
And probably what he was trying to do is to see if he could resect the root and still retain the tooth.
Uh-huh.
So I don't know exactly what he did, but what's part two of your question?
Part two is how could you correct that condition?
Well, it depends. Usually, if the tooth is fractured in the root, and it's not just at the end of the root, if it's fractured someplace in the root, then it's better to remove the tooth and do an implant or a bridge of some kind.
Larry, you got to move because it killed the rapid fire segment of the show.
Went fast.
But anyway, thank you very much for calling.
Okay.
I hope to hear from you
talk
soon.
To you again. Right.
Take care. Let's see. We could try rapid fire part 2.
Go.
Hi, Faye. How are you?
Hello. Good night.
Oh, very
That's
good.
fast enough.
No, we're going to give you an extra minute for that. How are you doing?
I don't know how I'm doing. That's why I'm calling. I'd like to know.
What's wrong?
I went to the emergency room because whenever I eat, I get this burning sensation in my stomach or my chest feel like I want to
Okay, so let's
burp, but it's just like a lump sitting there, and they diagnosed me with that reflux esophagitis.
Okay, let's ask Dr. Sokolov about that.
Okay.
Helen, what would you advise this reflux esophagitis symptoms?
Well, first of all, you need to find out what causes that, whether or not it's related to food. That's the most difficult on one hand. On the other hand, the most easiest way to solve the problem. You would not necessarily need medication. And if it is difficult to determine, then I would use medication for a period of time. And if it doesn't go away, once again, consider endoscopy just to make sure that whether or not there is a more serious problem.
Sounds like it's not serious right now. If you treat it, you should be fine.
Yes.
But can I take like Prevacid or those kind of things for it?
Absolutely. It's a fantastic drug. You just have to remember to take it 30 minutes before any meal in the morning, and then it works better.
Hey, thanks a lot. You could sound happier, you know, because it sounds like it's working out. It's going to be treated.
Okay. Thank you very much.
Take care. We got now a quick email question for our dentist. My toddler still cannot spit after brushing her teeth. How bad is it for continuous swallowing? Is it safe to swallow the toothpaste or not?
Well, it's not advisable to swallow toothpaste too much, but if she swallows a little, it shouldn't harm her at all.
So that's not to worry about. Let's go to Martha. Hi, Martha.
Yes, hi.
What can we do for you?
While I was on hold, I believe you touched on this topic. My son was diagnosed recently with internal resorption of a particular tooth, and this is new to me. I never heard of anything like this. He was told to go to an endodontist, and from what I hear, that they will have to remove the tooth, and they talked also possibly, I think, an implant has to be in place of that.
How old is your son?
22.
Does this sound to ring a bell?
Usually it results from trauma.
Yes, that's what they said.
And the advisability there, the treatment of choice in most of these cases is to remove the tooth and put in an implant.
Very good. And thank you very much for the question. I'm getting the signal that we've run out. I have so many more questions on here, but we can't get to them. And that's it. We can't do any more with this episode. So I want to thank Dr. Helen Kilkin-Sokolov, Dr. J. Herbert Balber, and Dr. Lawrence, what's the middle? Eric Stam. And we hope that we've been able to help you. It's good to remember you should be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions. In the meantime, visit our website at netny.net/askthedoctor, and here you can see video blogs, the tablet column, podcasts, the forum, and many more. I want to thank Dr. Linda Lapatosa, the quizmaster. Incidentally, we're going to carry this question over to next week. And next week, we're going to talk about pediatric neurology, epilepsy, adult sleep medicine, cardiology. We have a basketball team. I don't know, we have like 80 people here. Cardiology and lung disease and internal medicine. Anything you want. So until then, goodbye, and I'll see you in the tablet.